Good morning and welcome to today's webinar. Today we will be covering community conditions as it relates to children's well-being throughout the state and in your county. Today you will be hearing from me. My name is Kelsey Purdue and I am the Kids Count Project Director at the Michigan League for Public Policy.
And my name is Parker James. I am the Kids Count Analyst on the project.
Welcome. So our goal today is to gain a better understanding of economic security and the economic environment and landscape in Michigan and in your local counties and how that impacts children and families. We'll talk about employment and income trends, look at different definitions of needs and poverty, as well as explore family support programs. A little bit about the Kids Count Project. The Kids Count Project is part of a national effort to measure children's well-being to improve the lives of children and their families. We do that through data, watching trends. We also do that through research and advocacy to shape public policies and programs that ultimately improve the lives of children and their families. We use two main frames in our work. The first is that race, place, and income matter, and we'll show you some examples of that later. And the second is that in order to help children, we also have to help their parents, particularly when we think about things like economic security. And so we do use what's called a two-generational approach in our work as well. So a little bit about poverty and children's development. Children's development is an ongoing process that starts before children are born all the way through adulthood. And they have a lot of needs during that time to support their optimal development. Everything from basic needs like adequate food and housing and shelter, but other things that really support their self-actualization, right? And their creativity and their sense of self and their esteem. Poverty can be so detrimental to children's development because it lacks them of those resources that supports their development, all the way from those basic needs that we talked about up to kind of some of those higher levels. Poverty is not does not cause kind of bad factors or risk factors, but it is correlated with them. And so we do like to always point that out, that poverty is a risk factor, but our children are resilient and there are a lot of opportunities to kind of support them as they deal with the realities of the lack of resources associated with poverty.
So the Kids Count Project compiles the best available data from accurate and reliable sources. And so some of those sources include the US Census Bureau. From the US Census Bureau, we pull data from the American Community Survey. The US Bureau of Labor Statistics provides us with information like unemployment. Michigan Department of Education, we get some education-related indicators, enrollment in special education services. The Michigan Department of Health and Human Services provides us with data on family support program enrollment, data related to abuse and neglect, and data related to birth outcomes and other health indicators. The Michigan Department of Licensing and Regulatory Affairs provides data on childcare. And then the Michigan Center for Educational Performance and Information, or CEPI, there's a lot of data around test scores and other education outcomes. And for the Great Start Collaboratives, Kids Count in Michigan pulls special data specifically just for you, and that is located in the Great Start dataset that we're going to be using today in the presentation. And so in that dataset, there is a particular focus on young children. Ages 0 to 5 and 0 to 8 are the age ranges you will find most frequently. But for mental health, for example, it's broken down by 0 to 3, 4 to 6. And so there are some other age categories in there as well. We provide poverty by race for young children, the number and percent of young children in families at different levels of the federal poverty level. And we'll talk more about that later in the presentation. We pull infant mortality data by race and ethnicity, mental health services, child care centers, special education, and enrollment in programs that are particularly important for the Great Start Collaboratives, like the Great Start Readiness Program.
All right, so let's look at employment and income in Michigan.
So in the data set, there are two indicators that we frequently use to talk about economic security. So one of those is unemployment, and then the other is median household income. And prior to the COVID-19 crisis, we were really seeing an economic recovery, and so that was leading to lower unemployment numbers and higher median household income. And that's, a positive trend that we like to see, but we know that there was also a lot more to the story there. So in addition to just variation between counties and within counties and between groups, there's a few other factors that we want to consider here. For unemployment, we want to think about, what kind of jobs are people able to get? How much do they pay? Are they able to actually meet the needs of, those families? And then with median household income, the median is the middle value, right? So it's a little bit different than an average. With an average, outliers or extreme values can really affect the average. So with a median, that's a little bit less of a factor, and that's why we use it. And when we look at the average value of income, it kind of begins to tell a little bit of a different story and relates to inequality, which Kelsey's going to talk about in a few slides. But just as a little bit of an example, a 2015 study found that the average income of the top 1% in Michigan was $917,000, and the average income of the bottom 99% was about $42,000. So we can see how already, an average would pull our data a lot higher, and that is still a factor with the median household income value as well. But we'll talk a little bit more about income inequality here in a few slides.
So when we talk about employment and income, it's also important to talk about and look at what minimum wage looks like in our state. There are over 500,000 folks in jobs that pay less than $10 an hour, which is around minimum wage. But in 2018, there was an attempt to raise minimum wage. And so the league did quite a bit of research into looking at what that will look like for our state and who that will benefit. Minimum wage is not an issue of a teenage job issue. It's not an issue of kind of someone's first job. There are over 1/3 of folks who would benefit from an increase in minimum wage are over 40 years old. And as you can see on the screen, nearly 1/4 of workers who will benefit from an increase in minimum wage are parents who are raising children. In the other graph that talks about fair market rent, we see that wages for someone who is working full-time year-round and earning minimum wages, they are spending a disproportionate amount of their income on rent. And this is important because it takes away resources from other really important areas like money and budgets to buy food, to see the doctor, but also to create enrichment experiences and activities for kids as well. So this graph shows those first two dotted lines are different poverty thresholds, and that solid blue line is minimum wage over time. And we can see that even if someone is working full-time year-round and making minimum wage, it still might not be enough to take them above or out of poverty, okay? And we see that those poverty thresholds are steadily increasing, and that's because the poverty threshold is increased every year to keep up with inflation. However, the definition of minimum wage is not. And so you see those long stretches of time where the minimum wage is stagnant and again does not allow folks who work full-time or year-round, does not guarantee them a path out of poverty. And then a little bit around income inequality in our state. Michigan is one of the most unequal states in the nation when it comes to this. The top 1% of earners make more than 21 times as much as the bottom 99% of earners. This matters, and this is a root and structural issue when we talk about economic security and when we talk about equity. There are race and gender differences, but also some of our lowest earners actually pay a higher percentage of their income in state and local taxes. So when we talk about creating a better landscape and environment for children to grow up in, and to make sure that they have everything that they need to survive and to lift families out of poverty. This is a structural issue that we will have to address as a state and as a nation. This doesn't happen by happenstance. This occurs when policies, and this is true in Michigan, benefit the wealthy, benefit corporations and businesses, and not families, particularly working families. So that was an overview of employment and income in Michigan as our backdrop to understanding economic security, and how that relates to children's well-being in our state. Next, we're going to talk a little bit more specifically about poverty. This is a conversation that, we talk a lot about, and something, an indicator we look at a lot in our work. So let's get to it. So we have been using the federal poverty level to define who is poor in our country since the mid-60s. It is not a perfect measure. There are limitations. For example, it is not based on the cost of goods, and it is not adjusted based on where someone lives. So we know, for example, that it costs a lot more to live in Los Angeles than it does to live in Grand Rapids, Michigan. And so none of those factors are taken into account when these thresholds are created. But that being said, that is kind of what we use. And when we look at how poverty is defined in Michigan, you see a few different definitions on your screen. And about 30% of Michigan kids live in poverty. They live below that 100% federal poverty level. About 1 in 10 kids live in what's considered deep poverty. And poverty is most dangerous when it is deep, when it's sustained over time, and when it happens during a child's earliest years of brain and body development. But even if a family lives above the federal poverty level, we can see that those incomes are not necessarily enough to protect them from the lack of resources that is associated with poverty. Even at double the federal income or federal poverty level, families are considered to be low income. So when we look at childhood poverty over time for children ages 0 through 5, we see that it has gotten a little bit better, not a huge jump or a huge improvement, but it has gotten better over the last decade. But these are pre-COVID-19 numbers. And so we totally expect for these numbers to get a lot worse as we start getting data for kind of 2020. We do expect to see this increase for children across our state and across our nation. You'll see at the bottom of a number of graphs, and even in the data set itself, that some data is presented not in single year data, but as kind of this multi-year data, right? So 2009 through 2013. And that's because in many counties in our state, the numbers are too small to present with confidence. And so we have to we have to average out a number of years to find a data point that we're able to show. So this is just an example of kind of why you'll see multiple years represented, and that's just because we're using the average number for those years in order to be able to present that data for every county in our state. This is what poverty looks like by age group in our state. We have children and young adults represented here. And again, I mentioned that poverty is especially dangerous during those early years of development. And a number of our kids, over 20%, do live in poverty during those years of development. But I also want to point out 18 to 24. This age group are considered young adults. They are continuing their education. They are starting their careers. They're entering the workforce, and they are starting families. And so knowing that a quarter of our young adults live in poverty is also a challenge kind of in the greater scheme of economic security and children's well-being. We mentioned earlier that race, place, and income matter. And so this is an example where if we disaggregate our data by race, we can see glaring disparities. The blue bar that you see in front of you represents the percentage of children ages 0 through 5 who are that race or ethnicity. And then the red bar represents the percentage of children of that race or ethnicity that live in poverty. And if all things were equal, if we had a level playing field, if we had an equitable, fair kind of society, those numbers we would expect to be equal. We would expect them to be about proportionate to one another, right? But we see that is not the case. We see that children of color are disproportionately more likely to live in poverty and experience poverty. So race, place, and income definitely do matter. And then speaking of place, this is an overview of our state. And we see that in rural areas and in some urban areas, we have extremely high rates of childhood poverty. So again, race, place, and income do matter. All right, so we've been talking a lot about poverty and the poverty level, but also want to point out another measure of economic security, one that does take into account the cost of basic needs and does take into account where someone might live, some of those limitations that the federal poverty level does not consider. That measure is called ALICE. That is an acronym that stands for Asset Limited Income Constrained Employed. So these are working families that between the high cost of living and the wages that they earn cannot afford what's considered a bare bones budget. When we take the ALICE households together, along with those who are under that 100% federal poverty level threshold, we find that over 40% of Michiganders are struggling to make ends meet. And we have many, many more families struggling today than we did at the beginning of the last decade. So we saw earlier that childhood poverty has decreased in the last decade. But again, bigger picture, we see child poverty has decreased, but families might technically be above the federal poverty level, but it's not enough, again, to make ends meet. So this is something important to consider as we talk about community conditions and economic security. All right, so now we are going to transition into talking about family support programs. Family support programs are key because they do help families make ends meet.
Thanks, Kelsey. And so family support programs really do play a vital role in supporting families to meet basic needs. And these basic needs include things like food and nutrition, healthcare, income, and childcare. And so some of the programs that you'll be able to find data on in the Great Start dataset include the Food Assistance Program, Women, Infants, and Children, Free and Reduced Price Lunch, Medicaid, My Child, Cash Assistance, and child care subsidies. And so these programs really fill in the gaps, where we see, how families have a hard time making ends meet even when living above the poverty line. And so these programs do fill in the gaps where, families may be falling in our economy. And these programs are designed to serve families at different levels of need. And so here we come back to that chart that's showing us the different levels of income compared to the federal poverty level. And so we can see that a program like Cash Assistance is really designed for families that meet that deep poverty criteria. And then as we move up, eligibility expands a little bit. So for food assistance and childcare, that's around 130% of the federal poverty level. And then programs like Medicaid, My Child, WIC, Free and Reduced Price Lunch, those programs have broader eligibility and are designed to serve even more families and even more children. But it's important to remember that just because a family meets the income eligibility criteria, that doesn't necessarily mean that they qualify for a program. There are other requirements such as things like work requirements, renewal processes, and lots of different verification that families have to provide. Age can also be a factor. Medicaid's a good example where younger children have a higher income eligibility threshold than older children. So there's a lot of different factors here to consider. For cash assistance, there are also lifetime limits on cash assistance, and Kelsey is going to talk a little bit about that on the next slide.
So when we think about need and we think about access to programs and families being able to benefit from programs that should help them make ends meet, those two things don't always match up. And so a good example of that is cash assistance. If we consider the income eligibility for cash assistance, it's about 47%. So we're really speaking about children and families who are in that deep poverty category, and which represents about 9% of kids in Michigan. The graph, though, shows the decline in participation in this program over time, and there is such a drastic difference between participation rates and kind of that income eligibility and the sense of need. So there's a number of reasons why that happened. One is that eligibility requirements as it relates to income have been frozen since 2008, but also new policies that removed exemptions. So, for example, if a family lived in a county with high unemployment rates and they couldn't find a job, they could get an exemption to the lifetime limit for this program that allowed them to continue to receive cash benefits to help pay their rent, get transportation, just kind of make ends meet. And so those exemptions were removed. The state enacted new lifetime limits that were about a year less than the federal lifetime limit. So there are a number of decisions made that really affected participation in this program. And cash assistance, especially, is designed for families with dependent children. And so when we see such a drop and decline in participation as it relates to the sense of need, kind of that 9% of kids who do live in deep poverty, we can see just a missed opportunity that is being created and being able to truly support families and their children, again, particularly as children experience that ongoing critical brain and body development. Another family support program where we might see some disparities between income eligibility and actual participation rates is childcare. So we know that childcare in our state is not affordable. The cost rivals rent, it rivals mortgage costs, as well as college tuition and fees. If we consider again minimum wage earners, right, and we compare the average cost of childcare in our state to the minimum wage for someone who is working full-time year-round, that person will spend 36% of their income on childcare. That is a disproportionate amount and really cuts into a family's budget for other really, really important things. The good news in this area is that the eligibility for child care subsidies has been raised recently, so more families can access it. But however, it is not enough. And at the league and along with other partners and advocates around the space in this area, really want to see that income eligibility threshold raised even further. So we encourage you at this point to pause this recording and open the data set, open the Great Start data set. And in there, you can find information and data for your county, your unemployment rates, which we talked about earlier. You can find indicators that relate to the number of children who are income eligible for child care subsidies. If you look at those who are at the 125% federal poverty level. It's not an exact measure, but it's a really close estimate. You can also find in the data set the number of children in your county who have been approved to receive the child care subsidy. And we bet that you'll find some big differences between income eligible and those who are receiving. And so thinking about there's a lot of different reasons why that might be the case, and Parker is going to kind of review some of those that we have in mind and that we have heard from advocates and folks who do this work around the state.
Yes, thanks, Kelsey. So, when you look at the number of children that are income eligible for the child care subsidy, so less than 125% of the federal poverty level, and then you compare that to the actual number of children in your county that are receiving the child care subsidy or have been approved to receive the child care subsidy, you should notice a pretty large difference between those two numbers, with a lot more children, falling below that income threshold than who are actually approved for the program. And so, when we think about why might we be seeing that difference, there are a lot of things that come to mind. Something that has come up, when we asked the Great Start Collaboratives about this question, people stated, burdensome applications. There may not be an awareness, of the program and that people are eligible for it. The number of childcare slots in, their region or in their county, in their area. Some other ones that, may be relevant is whether or not there's even a child care provider that provides child care at a time that family needs. We know that in our state, there is a lack of child care providers that are able to provide care over the weekends, overnight. Care for toddlers and infants is also, lacking in our state. And so there are a lot of different factors here as when thinking about why, there may not be as many families actually able to receive the benefit than are income eligible. And I want to talk a little bit, just to sort of begin to wrap up here. The COVID-19 crisis is really going to change economic security for a lot of families. And so that's really important to keep in mind. Just like unemployment and median household income, we were seeing positive trends in terms of unemployment going down, median household income going up. There were certainly caveats and considerations, but with our assistance programs, we were seeing, declines in the percentage of children receiving food assistance and women, infants, and children. And, we were thinking this is linked to this kind of broad-based recovery. Certainly place still matters. So with WIC as just one example, this ranges from 15.1% of 0 to 4-year-olds in Livingston County to all the way up to 82.7% of 0 to 4-year-olds in Alcona County. So still a lot of variation, but we were seeing this overall trend. One thing I wanted to point out though is, and this is another great example of a policy change. So starting in 2017, students that were enrolled in Medicaid became automatically eligible for free and reduced price lunch. And so that's why we see that little jump from 2016 to 2017. And we can see this is a great example of making a program more accessible for families. So, rather than a family that is enrolled in Medicaid having to kind of go through the process to also get free or reduced price lunch, the decision was made that they could certify, students that are enrolled in Medicaid just automatically get this benefit, and so that increased participation in the program. And with the pandemic, we're already seeing how important these programs really are. So Michigan was the first state to be approved to distribute pandemic food benefits to those students who are receiving free and reduced price lunches. So this was really huge. Families should have received in the mail an electronic benefits transfer card with the maximum amount per eligible student preloaded onto the card that basically fills in what students would be receiving at school for lunch. And so this began for March and April and will be continuing. Benefits should also be issued for May and June. And this, goes a long way in helping to ensure food security for students amidst the insecurity of the pandemic. And we saw growth in enrollment in healthcare services as well. So Medicaid and My Child enrollment grew by almost 6,000 kids in March alone. And we will likely see further increases as that data comes out. As families who relied on employer-based health insurance, may see that health insurance go away. And so work requirements are also being put on hold, due to the inability for a lot of families to safely work at this time.
And with that, we want to thank you so much for joining us for this webinar on community conditions and children's well-being. We reviewed employment and income trends throughout our state. We talked about how we define poverty and families' abilities to make ends meet and what that looks like across our state. And we also discussed some family support programs. And again, we encourage you to open up the data set and find those numbers for your county to understand kind of what's happening on a more local level, and look at how you compare to counties of similar size or similar makeup, as well as kind of the overall state average. We also want to invite you to join us for another training on June 9th or June 10th. That is going to be an extremely hands-on training where we will really dig into the data sets and to help you understand, use, and communicate your local data. You can find a lot more from Kids Count online on our webpage, listed there on the screen. We have our data profiles for every county in the state. We have our fact sheets on a number of issue areas, and more and more. And you can also always get in touch with us for technical assistance when it comes to the data set. If there's something that you're looking for that's not there, we can likely assist you with that. Or if you have any other questions or inquiries, please feel free to reach out to either myself, Kelsey, or Parker with any questions. We would love to hear from you. And with that being said, thank you again for joining us. We hope this was helpful, and we will be in touch.